For the past decade, I've been interested in the care specifically of patients with problems related to the knee, and I've spent a great deal of time honing my skills in knee surgery. At the Philadelphia Center for Minimally Invasive Knee Surgery, we provide compassionate care for our patients, and we offer very unique surgical interventions for the patients who present with debilitating knee arthritis. There's been an evolution of our approach to knee replacement surgery. The technique has been modified over the years, the instrumentation has been changed, the implants have been modified a bit, and the natural transition has been to shorten our incisions and allow a less invasive approach to total knee and partial knee replacement surgery. Minimally invasive techniques for knee replacement surgery have been available since 2003. As an early adopter, I have spent the last few years honing my skills and modifying the techniques to better suit our patients in refining the techniques in the care of knee surgery. The biggest advance with minimally invasive techniques that makes them different than how we approached a knee 5 or 10 years ago is not necessarily in the implants that we're using, but in how we approach the knee and how we get the implants in. The biggest change has been in the surgical approach and in the instrumentation, which allows us to get into the knee joint through the smaller incision. If we can get these implants in through a smaller incision, we know that if the patients are doing well at 1 year, well, they should have the same track record that we have with our traditional total knee replacements. And that track record has been exceptional in 90% of patients at 10 to 15 years. When considering knee replacement surgery, patients need to consider several things. One is, first they have to evaluate whether they've exhausted all of the appropriate non-surgical interventions, because many patients with arthritis certainly don't need surgery. The other advantage of doing a unicompartmental replacement, and what patients need to consider, is what the personal experience is with the surgeon performing those particular procedures. In the United States, the majority of orthopedic surgeons perform less than 10 total knee replacements annually. Not all surgeons feel comfortable performing minimally invasive total knee replacement surgery, but there are others of us who perform a high volume of knee replacement surgery, who've really embraced the concept of minimally invasive knee replacement surgery because we've seen the tremendous advantages for our patients. And there have been numerous studies that show in the hands of surgeons who are comfortable with minimally invasive surgical techniques for knee surgery, the results are exceptionally good and better than the results that we are seeing with the traditional approaches to knee replacement surgery. The outcomes with minimally invasive techniques for knee replacement surgery have been tremendous. There's been a considerable reduction in the amount of pain that the patients feel after surgery, and this has allowed the patients to recover their strength quicker, their independence quicker, and get back to work much sooner than they would with a more traditional approach. And their hospital stays have been cut down to less than 2.5 days in most cases. And when you think about the earlier recovery, the diminished pain, the improved flexibility, I think the benefits of minimally invasive surgery are real. Our patients are no longer interested in simply having a pain-free existence. Our patients after knee replacement surgery want to get back to an extremely active lifestyle. And it's fairly routine now for our patients after knee replacement surgery to get back to fairly high-level athletic endeavors, such as skiing and doubles tennis and yoga and biking and golf. And it's really impressive to see how our patients nowadays are really taking advantage of their pain-free experience. Watching them return to activities that they hadn't been able to do for years is extremely gratifying and very rewarding for me as a surgeon.